Record, Instagram, Postural. Hey, Postural's around. Good to have you along, guys. So you've probably seen that I'm a raving fan of the vibration tools that Postural have been putting out there for a few years now. And I've now got the massage gun. And so, in fact, I know I'm going to do you a video, Paul, if it is you out there on the Postural page. I'll talk a little bit around that actually, but I'm going to do you a video as well, Paul, so rest assured. Let me just add that to my list. Right, okay, so welcome everybody. Good to see you. Saif's here. We've got Jane, Carl, Fiona. Hi guys. So as I've said, and as usual, you can post questions on Instagram, Zoom, Facebook. I'm not sure what's going on over there, whether we've got any live or not. Oh, it's moving. So yes, there is some activity over there. If I miss anything, I'm going to go back into each of the platforms just to double check, and I will get back to you if I can respond. And if I can't, I will guide you towards another resource or source to be able to find that information. So first of all, I hope you're all well. I hope you've all managed to get back to some form of gym activity if that's your thing. So I'm wondering whether people are all experiencing DOMS, some delayed onset of muscle soreness as a result of maybe their first session back in the gym and using weights. Certainly our clients. And so my blog yesterday was talking around sort of getting back into movement and understanding how we need to really be conscious of the deconditioning process on our clients' bodies, coming out of, post-lockdown, where many of us and our clients have had limited access to the kind of machines and the heavier weights. Maybe the state, I think I got a comment from one guy who said he was doing 90 resistance band. He's a big muscly bodybuilder guy. Hi there, Paul, good to see you. And so he's just been hammering a resistance band. So it's not the same. We've made the most of it, body weight and things like that, which we've talked about previously. And you've just got to make the most of it. But I think what has excited me is it's highlighted a real emphasis on just what are the fundamental bases of good quality movement just to stay healthy, which for me, it has been fantastic. And I just want to put a caveat in there. I'm not saying that this pandemic is a fantastic thing by any means. I know that it's been horrific for so many people, so I don't want to underplay that. However, we've got two ways of looking at things. One can be the things we cannot control, or we can look positively at what we can control, which is our body. And for us as therapists, biomechanics coaches, exercise to music instructors, manual therapists, strength coaches, personal trainers, really our role is to educate our clients on how to move well with a reduced risk to injury. And so I think if there's anything that we've been able to focus on, it really has been about physical health. And we can add in all the nutrition and mindset, but my speciality, as you know, is around the human body in terms of intrinsic biomechanics. And so if you want to read more about my background, you can go to the website www.biomechanicseducation.com. So my background is not clinical. I do have manual therapy training. I don't really apply it. I like to work in a team and use referrals because I like to specialize in coaching good movement and strengthening good movement in terms of using the body, using equipment, and sort of strength training from a strength background. Today's session is around about an hour. It is based on a question I posed to you guys, basically, all of that, you being collectively everybody out there on social media who follows me, if you could ask your personal trainer, tutor, your clinical tutor, your therapy tutor, to teach you something now that they didn't during your training. So basically, I'm hinting at the idea that we always come out of training thinking, I could have done with knowing more about this. What would it be? What would you have said to your PT trainer? I wish you'd taught me something else. So that was the foundation of the content for today. What's going to feed into it, and I've got some really interesting responses. So I'm going to work down them, and we can focus and elaborate on different sections depending on if and how any of you decide to respond. But the first one was quite interesting. So it came from a personal trainer who said, it wasn't quite a question, he just said the importance of postural correctness before resistance training, which I found a really interesting subject. So what I'm going to have to do is read between the lines in some of these, because that's the only response I got. And my feedback would be, I'm not sure they're both, that they're not the same thing in terms of an alternative. So the individual who sent this through says the importance of postural correctness, I think he felt was more important than the learning about resistance training. So I think what he's trying to say is, when you come out of personal training school, the idea that you can just use resistance training to help people move well, better, he felt that that wasn't enough. And so I would concur, but I'd just like to use his phrase, postural correctness, and maybe analyze that a little bit to understand maybe a little bit deeper what that statement is, what it might mean, because it is used quite a lot. Postural assessment became quite fashionable a few years ago, and still has education out there about it. And I'm sure, like you said, for example, from a sort of clinical background, we'll be having these conversations with clients around posture. So I think what we need to be careful of and mindful of is definitions and use of language with clients or patients or people we work with. And the idea that there is a correct posture, I would like to challenge, and I would encourage you to challenge. So there was an old school train of thought that there were sort of plumb lines. If you looked at somebody's side on for measuring bony landmarks in comparison to each other on the body, so that you had, you know, this upright sort of ASIS, PSIS positioning of the pelvis and the spine and everything else, that would be good, better, correct. And so I just want to challenge that a little bit. So I'm not challenging the idea of using measurements. That's what I teach in my education company. However, it's the interpretation of the measurements that I think we need to be mindful of. So I think certainly from the exercise world, the idea of correcting posture, we need to be careful that we're not overstepping our mark when it comes to problems that can arise and cause, you know, maybe structural deviations or even functional deviations. I'm going to go into that a little bit more in a moment. So the concept of postural correctness, I think we need to keep an open mind to the idea that every individual will have their own great, correct kind of posture. However, I'm going to challenge what I've just said, actually. And I know if Tom's out there watching, he will be with me on this one. He talks about posture quite a lot. So Tom Waldron is an amazing educator as well. So you can go and find him around social media. If you think about what posture is a body position. So in terms of a bad posture, I can have a bad posture and I'm okay. I stand like this, or what might be deemed a bad posture, round shoulder, hunched over. So I'm okay because I can move out of it. And I think what we need to consider is posture is just a definition of a body position. So to be definitive about good and bad posture may not be the appropriate focus. Maybe the focus should be on quality movement. And I think for the exercise professional, the amount of time we spend in certain postures. And I think that's potentially the crux of this. So for many of you out there watching this, you're probably sitting and you may have to sit for periods of time when you're working, when you're talking to a client, doing a consultation, when you're eating. You know, there are periods of time when the culture has given us chairs, which generally put our pelvis into a kind of a 90-degree flexion, or the body, the mid area of the body. And if we stay there for long periods, our body starts to adapt and change to that posture, maybe negatively. And I think if we start to think that maybe no posture is a bad one, it's about the variation of postures we use throughout the day, rather than, so if I'm standing, I'm talking to you standing, I've got my standing desk, I've got a chair, and so I'm trying to change my posture all day so that I don't have a bad one, a single one that I'm in all the time whilst I'm working at a desk, because that then becomes a bad or a negative posture because I've been in it so long, my body's kind of almost got used to that position. So I think the importance of postural correction before resistance training, the whole statement he came to me with, I understand. Resistance training and exercise is quite often a replacement for natural movement, where we've lost it through sustaining postures for a long time on a regular basis throughout our day. Does that make sense? I feel like I've just said a lot. I'm not sure if I kind of answered that, but what I'm hoping to have done is to really open up a way of thinking around posture, what's deemed postural correctness. And I understand the idea of correcting posture, but maybe we need to be careful about what we're saying to our clients and the way we interpret posture. An example would be somebody who has a structural overflexion, hyperflexion, hyperkyphosis of the spine, and that may have been, they may be born with that, but it may have developed over time. And understanding what that means in terms of being able to improve or correct. So a client's level of expectation needs to be appropriate. So rather than saying to everybody that comes along that they may need a specific posture, a perfect posture, a certain posture, I think what we should do is focus on the quality of the movement for the individual, use benchmarks of their positioning and movement today compared to once we've addressed some of the issues. So I hope that kind of makes sense. I'm just going to come down and check if there's any questions that's come up from that one. Paul's agreeing. Hi there, Raoul. Good to see you back. John Furman's in. How you doing? Cool. Check if there's any questions before I go on to the next one. Sorry, doing my gourmet face. Paul says, muscles, their attachments and actions practically rather than just pictures in text. Yeah, I'm going to come to pictures in text in a moment based on one of the other pieces of feedback. I have APT from sitting all day. So we can acknowledge that we're kind of appreciating and understanding that, I guess. And then interestingly, somebody followed that up with the statement, corrective exercise paramount, exclamation. And so in response to me saying, what do you wish your PT tutor had taught you in your personal training course, corrective exercise paramount was the response. So I think she's coming back with the idea that she felt like she wanted to know a bit more. And it is again about correction of physicality. So I think one of the big limitations of personal training education is potentially it's not quite caught up with the modern ailments that personal trainers see in clients today that are deemed normal, everyday poor postures. They're not normal, they're common. They are a result of our lifestyle, technology advancing, our work going more and more online, and we need to be aware of that for us and our clients to understand when we may need to address it, which might be the corrective exercise concept. So simply moving around more will be helpful, but there may be that we need to add in some I move freely techniques, some muscle energy techniques, nerve mobilizations, mobility drills, maybe some manual therapy. All this is corrective kind of exercise or techniques anyway. And also using things like pulse roll, lacrosse ball, foam rollers, mobility sticks, you know, all this kind of equipment for self-care, self-physicality care. So understand what corrective is. So if we put corrective, I actually put corrective exercise into the internet search bar, and it says it is a technique that leverages an understanding of anatomy, kinesiology, and biomechanics to address and fix movement compensations and imbalances to improve the overall quality of movement during workouts and in everyday life. So that's the definition that it shows on the internet for corrective exercise. And so I think that just comes back to understanding the body better, understanding how to test it, how to benchmark our clients' movement quality, so that then when we're working with them, we know when they may need a special technique, or when something doesn't work, we have something else that we can put in to use to try and see if that changes the way they move and improves the quality of their movement. So I hear both of those, and hopefully I've kind of come back with a response to those. The next one was that the general public do not squat like in the textbooks. So I think anybody out there who is a movement professional of any kind, or a therapist in fact, will have learnt from a textbook to some degree, whether that's the handout you were given by your education company or whether you invested in your own anatomy books. And so when you look at things like squat positions and the way we squat, and books that teach us how to coach squatting or an example of a good squat, I think once again what I want to encourage us to do is for everyone to always challenge it. If you have an image example of a good squat, it's only going to be for the person with the same dimensions as the person in the photo in the book. So, and it's also only one example of a style of squat. So you can squat ass to grass, you can do a goblet squat, a back squat, a front squat, an overhead squat. You could squat to 90, you could, you know, there are so many variations, split, Bulgarian split squat. So I think we need to define the squat first. We need to define what the goal is in teaching somebody how to squat, and just check that they marry up. And then we look at that individual's quality of squat based on that information and what we know about them in their consultation. So the person who sent that in, I totally agree, but I think no textbook that shows, well, I'd like to think that any textbook that shows an image of a squat isn't going to say that everyone should squat like this. I think that would be poor or limited information. I know people do talk about that, talk in that way, and I think what I want to encourage you always to do is to challenge something if it doesn't ring true. And you can be challenging without being, you could be challenging in a diplomatic way. You don't have to be challenging in an annoying way. You could be challenging in a, can you explain why? Or what about this kind of client? And I would like to think that an educator or somebody who's written a book showing one method would be able to explain their view and offer a solution to an alternative. So I hope that helps on that one. And then we had one that in response to wishing their PT trainer had taught them more, they said They wished that they were helped to understand how muscles actually work through movement and act under load. So flat pictures and memorizing names didn't work well for her, although she acknowledges that technology is better nowadays. And I think it kind of comes back to what I was saying about the textbook and the squat. Certainly 30 years ago, when I was doing my initial anatomy training, we didn't have apps, we didn't have phones. You know, I think we only had 4 channels on the telly, maybe. But understanding how now we have access to far more resources, and there are some amazing apps out there that are really helpful at showing anatomy more in 3D, where you can use your finger and swivel the image to understand better how the muscles attach inside, outside, underneath and round. And I think for many of you have probably seen those and had a play with them. That is so much more helpful. And I think for this lady, who's probably more of my generation, will have similarly, she's acknowledging technology. But at the same time, I want to really take the point she made about actually sort of working through movement and how it acts under load. And I think that's another key point, is even these fancy apps don't always give a true representation of what's happening. And this is where our skill really comes in. This is where a personal trainer is needed. Personal being the key word. It has to be that individual stood in front of you when you're coaching them to move, and then in particular if you put in a load on them, the risk increases. Again, context dependent, but you add an external load, there is more risk potentially in terms of compressive force or shear force or whatever's going on, and balance and coordination and so on. So that really comes purely from working with different bodies. That's why in your training you're asked to do a case study or several. I'm not sure one is enough to truly understand, which is again why I think when people come out of PT school with a certificate, really proud and great, and they get their insurance, then they go out there and then work with people, and then they're like, wow, I actually need to know more. And which is what actually inspired me asking this question, is I think, I hope that personal trainers recognize very quickly the purpose of CPD, the purpose of progression in your education, and the idea we should continue to be educated to expand our understanding of complex clients, or how complex the body can be, how different we all are, and then how to work with those individuals by doing additional training and education with further training providers. So it helps me to just acknowledge that, but it is impossible to learn purely, I think, in true honesty, integrity, just from a 2D manual, which is how I learned. But obviously then I went away and worked with human bodies and realized how little I knew. So just coming over to Instagram, I saw some comments coming through. So Vinay said, lower limb spasticity, what we can prefer. If you could elaborate a little bit more on that question, just so I can understand it better. In terms of what you mean by lower limb spasticity. And I think you're asking what can we do, maybe? I'll wait and see if you respond so I can get a broader understanding of your question. Unable to wake because of lower limb spasticity. I think, Vinay, you may be speaking about a clinical, it sounds a little bit like, I forgot the terminology now we use, when the legs are overactive during sleep. And there is a condition, I believe, that is, and I can't remember what it's called. What's it called? Help me out, somebody. I can't remember. However, I don't have much knowledge of the condition. I'm aware of it. I've never worked with anybody with it, I'm afraid, Vinay. So I'm not sure. I would imagine things along the lines of hydration, therapy, and good movement, but I don't know the triggers. So if you can let me know a bit more detail. That's the one. Thanks, Paul. Restless Leg Syndrome. So I'd have to go on the internet and do a search just on that one. I'm aware of it. My understanding is I don't think people know a huge amount about it. So if anybody out there has ever experienced it, knows the clinical cause of it, or mechanical cause of it, please share so that we can all have a look, and I can share it with all the platforms that I'm on in here. Thanks for that, Vinay. Then we had somebody respond with how to combat arthritis. I think this was a question coming from a personal experience. And just to highlight, I'm afraid arthritis is an aging disease. I'm sorry. I'm not sure you can not get it, but her terminology was combat it. So I think she's talking about when you have it, what can you do? So again, it's a normal wear and tear condition. It's one of the most, osteoarthritis is one of the most common forms of arthritis, and an infection or injury to the joint can exacerbate it. So obviously avoiding injury or infection would be great, but I know that I've never known anybody go out and deliberately get an infection or injured, so it's a moot point. But there's a natural breakdown of cartilage tissue, and then the risk of developing things like osteoarthritis can be higher if you have a family history of the disease as well. So in terms of how can you combat it, understanding pressure around joints. If someone is uncomfortable, it's going to be challenging. So I probably wouldn't be wanting to move them around too much if they're really uncomfortable. But the areas of the body that do move well, keeping those healthy, the tissues and the structures, maintaining those, the health and movement through those, keeping hydrated in terms of both consumption of food, the right foods and fluids, but also in terms of movement. Movement hydrates joints and soft tissue and connective tissue, but it's got to be within context. And so if I was working with an individual, it would be a personalized movement program based on everything they're telling me. So I think we can't stop it necessarily. We can reduce risk, and we can maybe consider ways to reduce load on joints that are arthritic, but I'm not sure we can cure it at all. Andy's putting in plenty of anti-inflammatory foods, greens and green tea. Andy, was that in response to restless leg syndrome? If you can just clarify, that would be amazing. Oh no, osteoporosis. Sorry, osteoarthritis. Thanks, Andy, just seen it. Keep moving, collagen and cod liver oil. Okay, so Paul is saying about restless leg syndrome for Vinay, it's still unknown why. So yeah, I think there are some conditions that we still don't know about. But I think that's a good point actually to highlight for anyone who has any anxiety about their level of knowledge of the human body, is just to let you into a big secret. So this is a massive reveal. I've said it before, but I'm going to say it again. So it's not really a reveal. Everything to do with the inside of the body, of a living body, so my body, for example, is a hypothesis. Yes, I've said it. Nobody knows. Everyone's guessing. The surgeons, the doctors, the physios, the chiros, the PTs, the manual therapists. We're all guessing, because when we actually get into the body, and I'm talking like we chop it open or we scan it, that in itself is going to change some degree of what's going on. So we're having to surmise based on what goes on with a living body that's not chopped up, what happens when we see a scan, and then what we see when we chop someone open who's still alive, and then we're looking cadavers. And all of this, over time, we collect data on how people present, what happens, and then we come up with hypotheses. And hypotheses are really about understanding the human body and the anatomy based on what we've seen in the past. So if you take a certain demographic of client, a strength athlete, and then you understand from all the strength athletes that have been MRI'd or scanned or chopped open or whatever, we get this commonality. The problem with the hypothesis is it hasn't happened for every type of strength athlete, or you're always going to get someone who isn't the norm. So even when we find a really good result, something that is repeatable from input-output trials and data collection, there is going to be someone where it doesn't actually happen or sit or work for. So understanding where surgeons, when they're going to chop you open, when you're being chopped open for the first time, they don't know what they're going to find until they chop you open. Even an MRI scan, I've had a couple myself, gives you limited information about a moving, dynamic human, you know, by comparison. It says, it gives you an image, it gives you a portrayal of where tissues and things are positioned at the point of the image. But then when you move around, things change again. So it's just to understand that certainly on movement-based concepts and theories, a lot of it is hypothesis. And so there's some great hypotheses. There's hypotheses that work really well and give a good result. But again, we need to appreciate that and understand that, I think, when we are concerned maybe about our level of knowledge about the way the human body works. When you're looking at somebody's squat, why we all move differently, understanding we all have different geometry, design, injury history, tissue tolerance, ability, and so on and so forth. So I hope that makes sense. You might be able to hear my dog. He's shouting at me through the window. Okay. So another one, which is a really good one I wanted to talk about, was questioning about training with hypermobility. And so this is where flexibility, which for many in the industry has always been a big issue and a big focus. I need to be more flexible. And yet people who are hypermobile, that is probably the last thing that they want, is more mobility. So the change of focus, training somebody with hypermobility, will be about stability, control, stability, and strength in position. So hypermobility means that your joints, they're more flexible than other people. And when we have the term hypermobility, which is would be a diagnosis, or hypermobility syndrome, it's when that excessive movement is coupled with pain, and it's related to that excessive movement. And so still, I think movement-based interventions can be helpful, but it would be more towards function in terms of stability and control. And then I just had a little look through whether they're, yes, so also when somebody's hypermobile, they may be more at risk of straining ligaments, so there can be a higher risk of injury. So again, we might consider certain modalities of exercise aren't appropriate for somebody who's hypermobile, but we wouldn't necessarily rule it out. Just going to come back, say hi to all the people who've come in. Hi Eddie, how you doing? Good to see you in. Vinay, kinesiotaping is best for reducing pain or passive movements. I'm not sure I'd use the term best, Vinay, but it is one solution that we could try. So again, I was posed this when I was putting promoting the Postural equipment, and I was challenged on, do you think that's the best tool for improving movement? I said, well, no, every tool or technique will help someone, but it won't help everyone. And so we as human body practitioners need to be aware of techniques, tactics, skills, tools, equipment. I know there's people out there who say you shouldn't use equipment, it's a load of rubbish, it's a lazy practitioner who uses them. I'm not so sure. I think if you have a client who responds badly to other techniques, they're just not responding to hands-on or certain exercises, you could potentially then use something like a massage gun or kinesiotaping, for example, and they respond really well to that. There is an argument then for that. And even though evidence for certain tools and equipment is not necessarily huge in some aspects, who cares? Look, if it works, who cares? I think that is where we need to definitely read the research, look at the evidence, but try it. I personally love using this massage gun that the Postural guys are now promoting. And I just, when I've got DOMs, I don't really want to be supporting my body on the floor whilst I roll over a foam roller. I can't access a manual therapist because we've been in lockdown. So I'm going to use a massage gun. And do you know what? I really enjoyed it. I felt better. I had fun. So I think everything has its place. And so rather than Vinay saying that something is better, I think we need to be mindful to use maybe a series of techniques. I think movement-based programming is important. Let the body do things itself naturally by using proprioceptive tools, light muscle energy techniques, and nerve mobilizations, etc., balance work, and so on. But I don't see why we can't complement that sometimes where it might work. Thanks, Jenny Ann. I love this view. Moved up. It reflects how I think about things. Being open to something different is good, even if you decide it doesn't work for you. Yeah, perfect. Paul says, I believe everything has its place. K7.stallion_Gymland. I read somewhere your muscles doesn't know whether you're using machine or free weights. It understands only mechanical tension and load. Muscles maybe, but you've got to remember your muscles are attached to a human. So I kind of get it, but think more holistically always, so that we're not missing something. And I think this is where sometimes people's ideas can become narrowed through a concept. And I want to always pull yourself back because I'll highlight it again. The single most important denominating factor in you working with a client is that human standing in front of you. It doesn't matter the equipment, doesn't matter the tools, doesn't matter how many knowledge you've got, how much skills you've got, how fantastic a program you wrote for that client the day before. When they walk in, and what you see on that day is the most important deciding factor about what you do with them. So I hear what you're saying, K7. I'll call you K7 for short because that's a bit of a mouthful. We hear all these things, but again, maybe in terms of evidence, but also pull yourself to the top of the parapet when you're thinking about working with a client, that sometimes it will work with this client, but it won't work with another client. So just, I think, keeping that as at the basis of your thinking and program writing for the session. So this last one is a little bit different, and it is about managing all the online and social media stuff that we appear to need to do now. So I thought this was quite a good one to just chuck in because I think it's absolutely right. And it kind of links back to what we were talking earlier about posture and how we and our clients are using technology more. We're bent over technology quite a bit. But how do we manage that? And I've got a really simple solution, and then I'm going to talk around it. Delegate. I think if the lady who put this up, you know, how to manage all this online social media stuff we need to do now, maybe taking some of us outside our comfort zone or our skill level in terms of how do I gain exposure? How do I communicate to potential clients or online clients using technology? How do I do that effectively, efficiently, inexpensively? Ask a tech nerd, get a geek on board. You know, these youngsters coming through, I sound really old, don't I? These youngsters coming through who have grown up with technology, gone to school with technology, gone to college or university with technology, maybe a teenager who's looking for an apprenticeship or practice or a case study, or they're very keen, could either be a sponsored employee apprentice, they may just want the practice. I'm not sure using family members is always the best way. You know, you might be trading. Will you do this for me? Yeah, if you buy me something or other. So maybe not family members. But being all serious, we could delegate to someone who does that better. So find someone who understands technology. And I think The reason I'm making that as the suggestion first is technology changes so quickly. The way Facebook uses algorithms changes all the time. Now, I sound like I know what I'm on about. I really don't. I have two tech guys, a web guy and a marketing guy, who help me understand enough that I know when I need their help and when I can carry on doing stuff myself. I know where to go to learn and get it from the people who that's what they do. They write programs, they build websites, they design ClickFunnels, their job is to research the latest tech things coming out. So if you can get somebody like that on board, and I'm aware there's a cost, even if it's temporarily, periodically, to learn from them and then maybe do that yourself. I like to do things myself. I want to try and stay down with the kids, and kind of be able to help you in the same way they're helping me. So I can translate what I'm learning from my tech guys to help my learners or the people who are listening to me or looking to me for guidance on the way I've learned and done things. So I like to understand it a little bit, and then I can say, oh, have you tried this? So yeah, delegate and or periodically delegate, or go on courses or get educated into how to do something in a certain way, using technology. So that would be the answer to that one. Another one that came in just towards the end was the Biomechanics of Movement. But this is a massive one, so I'm not going to focus on this, but it might feed next time. The Biomechanics of Movement patterns of the core movements like squats, lunges, planks, and press-ups for athletes. So that was a question that came in, and it's a massive one. Because the person who posted it is suggesting that core movements are squats, lunges, planks, and push-ups, press-ups. So I'd like to talk about that. But also the biomechanics of movement patterns for all of those would probably be over 5 of these Q&As. So I just wanted to bring that up just to see if it inspired further questions or ideas for future Q&As that we're doing. So let me just come down because I've seen that K7's just posted something. I haven't yet read Stuart McGill's book on back mechanics, but I hope as a fitness coach it will be of immense help to understand the back pain. There's so many things that can result in back pain, and McGill is definitely a world leader in the spine biomechanics. He's done about 750, 800 studies on spine biomechanics using pig spines, which are about as close to human and keep him within the ethics boundaries. And so he's definitely a go-to guy. He's done a great book called Ultimate Back Fitness and Performance, aimed at the lay people like you and I mean lay as instead of clinicians, where he's written the clinical low back pain books, which may be more clinically, more technical. But the Ultimate Back Fitness and Performance is a really great tool. And also the back mechanic. Now the back mechanic books, the smaller ones, I think are more aimed at your clients. So I think Ultimate Back Fitness and Performance might be a better one for you to have a look at. Maybe more expensive, I'm afraid. But again, just have a flick through. You can usually get a little view of it when you go and have a look on Amazon, those sort of places. They give you a kind of preview. Yeah, I've got all of them pretty much. So definitely a fan. However, I'd just like to highlight there is the risk that if you focus on the back to solve back pain, that you are missing other potential influences like the pelvis, the shoulders, the knees, the feet, the nerves in the rest of the body, the other joints, the other areas. And so Stuart McGill is a superb educator about the spine health, spine biomechanics, the spine under loads. But I think he's also open to the concept of other parts of the body. So keep that open mind, K7, and hopefully that will help if you're looking to expand your knowledge into the causes of back pain, because the back is not the only cause, and from my professional experience, often isn't the only cause. There are multiple things that can contribute. So, couple of things before I bring this to a close. the pulse roll, just to waylay any questions anyone's got about the fact that I'm promoting it, is I'm not very quick to promote products because I am, one of my core values in my company is integrity. I will never recommend a product I haven't tried or I don't think is good. I will talk about it honestly. So I think I've done that throughout this video. I am a fan of Postural in particular. You can get other vibrating tools. I like their products. I think they're at the higher end in terms of quality, which makes them a little bit more expensive, but I am a big believer in you get what you pay for. So, but I like it as a complement. Just the caveat is, it isn't the solution to movement problems. It is one of the tools I like to use. So hopefully that helps. And then, so save the date, August the 12th, 12 till 1:30, I'm going to be running a masterclass, which you will need to book onto. It will be a Zoom masterclass. So it will be in a couple of weeks at this time slot, but I will only be running it through Zoom as far as I'm aware. I think that's the case. You need to book on. It's going to be called 5 Reasons Why Strength Work Isn't the Answer for Weak Glutes. I'm going to be teaching techniques and ideas throughout that, and then I'm going to be talking about ways to identify how or why your client's glutes are weak and what you can do about it. My dog is shouting at me. He's had enough time out there now. Finally, the Biomechanics Coach Diploma is fully booked for September in London. I'm sorry. September in Nottingham, we've got a few places, and I've put an extra date on in London in November, and I've got a few places left. So if you're interested in some of our training, you want to learn how to assess the pelvis and spine biomechanics of your clients, go on over to the website, biomechanicseducation.com, or you can email me directly, my personal email, rachel@biomechanicseducation.com. You can also private message me in Instagram, Zoom, Facebook, whoever can hear me, and let me know if you're interested. Send me your email and your phone number, and I'll send you more information and we can have a chat. I think that's just about everything. No more questions coming through. Oh, K7 today, only I read somewhere 80% of back pain is not because of the pain. Or the back. Yeah, I think pain science is a huge one. K7, if you go over to the YouTube channel that we've got, Biomechanics Education YouTube channel, there is one of these recordings on pain science. I talked around it a little bit, but definitely go and have a look at that. So I think that's it. I'm going to bring this to a close, and hopefully that was helpful. Here next week, but if you keep August the 12th in your diary, I'm going to be sending out, so send me your emails, you can do that privately, send me your emails for access to, it's a free masterclass, it's an hour and a half talking about weak glutes, 5 reasons, and how to identify that. Okay, just got some message coming through, I think that's everything. So I'm going to say goodbye. I'll see you all on the other side. Have a great day. Stay safe. Take care. Move well. Keep moving. See you, Harmony. Thanks for coming. Nice to see your face. So let's stop that one. That one.